Hi guys, so today we have a very interesting case. We did a central line on this patient. However, as you can see, the central line, it went in from the internal jugular and the course is kind of strange. So let's take a look at the anatomy. What are we looking at? So looking at the neck anatomy, when we do a central line, we use the internal jugular, either the right or the left. The right side was a little difficult, so we went through the left side. So when going in, you go through the internal jugular, and the normal course is to go through the internal jugular into the brachiocephalic vein, into the superior vena cava. That's the goal. That's what a central line does. However, in this patient's case, when we went in, the central line went in through the left internal jugular vein. It went to the brachiocephalic vein. It detoured and went up to the brachiocephalic vein and into the right internal jugular vein. So let's take a look at the X-ray one more time. And as you can see, this is the left internal jugular vein, and it courses, and it's supposed to go into the superior vena cava. However, in this case, it went up to the right internal jugular vein.